Welcome to another episode of Dental Marketing Go. I'm your host, Gary Bird. I'm the owner of SMC National, where we help offices just like yours level the playing field against the big guys out there so you can grow the way that you want. But you can't grow if you're not getting the right kind of patients. You know, I hear this all the time. Gary, I want quality patients. I want quality patients. And I hear doctors when they say that, and I understand what they're saying. But a lot of times they're actually asking for something that they don't realize that they're asking the wrong question. Okay, so they're saying quality, but there's a lot of things that go into quality, and there's actual kind of patient that they're asking for, and I'm going to explain that today. And if you've never heard this part of the presentation that I've done before on the trust funnel, it's going to really help you understand what I'm actually talking about. Okay, so I'm talking about patients that trust you. When doctors are saying, I want high quality patients, what they're really saying almost always is, I want patients that trust me. And I'll explain this in more detail. Okay. So let's first talk about the different levels of trust. So high trust patients are patient referrals or doctor referrals. Why are those high trust patients? Well, they're high trust patients because someone else has already done the selling for you. So what does that mean? So let's say I go to my wife and I go, you need to go to Dr. Smith. He's amazing. He will take care of all of your dental needs. If she calls in to Dr. Smith and they don't answer the phone, guess what? She's going to call back. If she calls in and they answer the phone and they're not the best on the phone and they really don't know how to answer her basic questions, she's still going to schedule. If she goes to schedule at this office and she schedules 2 weeks out or 3 weeks out or a month out for her needs, she's still going to schedule and she's still going to show up. And then if the doctor overtreats and presents probably more than what she was asking for, or if she's, something else goes wrong, whatever, on the patient journey, whatever, it doesn't matter. She's still going to accept the treatment. Why? Because someone else did the selling. I did the selling. The referral did the selling and said, Dr. Smith is so awesome. And that's why they're high trust. And these are the actual patients that doctors love. When they say, I want quality patients, I don't want shoppers, right? It's the opposite, is a shopper. The problem is everybody's a shopper. Everybody's a shopper. It's just that some have been sold prior to coming to your office and some haven't. So when a doctor refers somebody to your office, it's the same exact thing. They're high trust because someone else did all the selling. So what you have to do is you have to understand that these high trust patients, you can't get these from marketing. Why? Well, you can get some trust patients from insurance and drive-bys. Okay, so this is the second layer of trust. Some trust. And a lot of doctors, they don't want to take more insurances because the patients kind of trust the insurances, right? Oh, who do you recommend that I go to? Oh, over here? Okay. And there's some trust there, but the trust isn't with you. It's with the insurance company. And doctors typically don't want that, especially the ones that we work with. They want to break away from that, if anything. It's nothing wrong with it. It's just a different way of doing business. It's a different way of marketing. Insurance is a different way of marketing. Okay. Drive-bys and locations are great, but you have to pay more in rent to get these kinds of this kind of trust and this kind of patience. What am I talking about here? Somebody drives by your office, it's on the corner of a busy intersection, and they see your office, they see your sign every single day for the last 20 years on their commute. There's some trust there. It's not all the way trust like a patient referral or a doctor referral, but it's a lot of trust. Okay? So this is much different than a patient referral in a drive-by. But we're talking about digital. These are low trust. Any mass media, TV, billboard, radio, postcards, or any internet marketing is low trust. It's the worst kind. And you say, Gary, don't you run a marketing agency? Don't you own a marketing agency? Yes, I do. But they are the lowest trust patients. They do not know you. They're doing 5 minutes of research before they call you, if that. And they're just calling. And if you don't answer the phone, they call the next dental office. And if you do answer the phone and you don't know how to answer questions, they're not going to schedule. And if they do schedule and you schedule them 2 weeks out, high chance they're going to no-show. And if they do show up and you present a ton of treatment on the first visit, you're going to scare them away. And they're low trust. So you say, well, why should I market then? Well, here's the problem. High trust patients are not scalable and not predictable. You can't count on them every single month. Let me give you an example. If you lose a doctor, an associate in your office, or someone leaves a bad review or something like that, your patient referrals can drop. And it's largely reliant on hoping that people talk about you, right? So you got to keep asking for them and those kind of things. So even if they are predictable, they're not scalable. And you say, well, what do you mean by that? Well, very simply, if you add a new associate tomorrow and you need 40 new patients to make sure that they stay busy, you can't do that with patient referrals. If you say, oh, I want a certain kind of treatment, I want a lot more implants, you can't do that off referrals typically, right? If you say, I want to add a new location, you can't just do that off of referrals. You have to learn how to market, okay? And I'm going to talk about the secret of how to tie this all together. SunTrust patients typically are not scalable and not predictable either. You can pay more in rent to get more walk-by patients, but you got to pay a lot. It's a lot of money for prime real estate, right? So and it's not predictable and it's not scalable. Once you hit the number, you can't just double it. You can't say, okay, now I want more. It doesn't work that way. You get what you get. You can scale insurances, but you got to be willing to not be paid for your work. And I know that drives everybody crazy, right? You can join every single HMO and every single insurance out there and grow that way, but then you're not going to be profitable and you're not going to be happy and you're going to cry. As Dr. Nacho always says, you're going to cry inside, right? And so you don't want to do that. So then we got to learn this. Now, here's the thing about these kind of patients. They are predictable and they are scalable. You can get to a fixed cost per new patient driving through the door. Let's say for your office, it's $200 to get a patient through the door from marketing. And you have to fix some things, right? You have to learn how to answer the phones. You have to learn to answer the phones. You have to get some systems put into place to do that. You have to get the patient scheduled right away. You can't wait 3 weeks, 4 weeks, put them out. And then you have to learn how to deal with their chief concern of why they're coming in and address that before you address all of their other treatment. And then you have to get some patient financing and different things like that to make it more palatable for them to come in and do treatment with you. You learn how to do these things. Here's what happens. Your low trust patients end up referring people to you. And guess what? Those are high trust patients. This is how people grow. So when you see people online, I post case studies all the time. And it's like, we had 150 new patients every single month and we're doing $500,000 a month in collections. You go, how in the world are they doing that? They figured this out. They figured out how to take low trust patients and turn them into high trust referrals. And that's where the power of growth comes. But you got to learn some things. And this is where the nuance comes from. The growth is not actually in the marketing. It's in operations. It's in answering the phones, phone conversion, scheduling right away, getting them in, getting them how we present treatment, what tools do we have to offer them, options to make payments. This is the secret to taking these low trust and turning them into high trust, which solves the doctor's problem of, I just want better patients. Now, I will say, some people don't know how to target. And there's tricky markets. I'm working in a market right now, and it's trickier. I'm working with a doctor in a market in Florida. It's his office is near high income areas, but his office is actually in a low income area. And all historically, his patients have all come from low income areas, but he wants high ticket patients and non-Medicaid. That's trickier. That takes more time. It takes more energy. It takes more at bats, reps over and over and over and over again, right? But for most people, for most markets, you can actually go in and you can target and get people who can afford treatment. That's really what you should be asking for. So when you say, I want quality patients, what I hear is, well, you want more patient referrals. And then what I usually present back is, what if we drive you people who can afford treatment, and then we tweak your operations to make sure that those people come in and come back for more treatment and invite their friends and family? That's what we really want to focus on. That's what we want to hit. And if you get that down, now you can actually grow, and you can actually create maps around that. So this is something we do for all of our clients and potential clients, is we can create targeting maps of your area, figure out where your high trust patients are already coming from that have money to afford the treatment that you like to do. And then we can go and market to those areas and attract more people in. And then you tweak your operations to make sure that those patients can make it into your office. And then guess what? They start referring more people and you grow and everybody's happy. The marketing company's happy. The dentist is happy. The team is happy. The patient's happy. Everybody's winning. But you got to understand the difference between high trust, some trust, and low trust. So if you're listening to this, comment down below, no matter where you're listening to. We're live streaming right now on Facebook, but also we're going to repost this to YouTube. We're going to have this in a lot of different places on a podcast stream, all those kind of things. So wherever you're at, DM us or comment below and just simply say, hey, I want those maps. I want you to help me build those maps out. We'll help you build them out. Or if you work with another marketing company, this is something that will help you. This is something that will help you take back to them and say, hey, I got this map. I want to start targeting these areas. We'll build it for you, no cost. Happy to do that for you. So this is our first live stream. We're going to try to do this every single day, just doing little different frameworks like this, different marketing hacks that will help you grow. And I hope it's a value to you. Comment below, give us a thumbs up wherever you're at, wherever you're listening to. That really, really helps us. All this content's free, so we don't have sponsors and things like that. So I need your feedback. Thank you so much for joining us, and I'll see you next time. I'll see you tomorrow, same time, same place.